Hi, it's Mark from Top Local Lead Generation. We're here this morning with Dr. Sonya Jensen of Divine Elements Naturopathic Clinic in Vancouver. How are you today, Sonya?
I'm good. How are you?
I'm good. So we're going to talk about a really common issue, I think, but
Yeah.
how it applies to children and infants is eczema. So this is something you've dealt with a lot. What's the story on eczema?
Well, eczema, I guess the definition of it is inflammation of the skin, and it usually shows up with red, patchy, kind of itchy skin in infants, usually either on the face or on the flexor folds, so the joints. And children, same thing, and maybe even all over, really depending on the severity of the eczema case. And it can be as simple as just cradle cap, which most infants do have. So, like you said, it is very common, and I would say most people end up having some sort of an experience with eczema in their life. Yeah.
So what are the triggers and causes of infant eczema?
So, if the mother is nursing and say she has some food sensitivities that may be coming through the milk when the baby is feeding, that can sometimes create inflammation in the baby's skin. So, they're reacting to those kind of inflammatory foods. Examples could be cow's milk, for some wheat and gluten, citrus, nuts and seeds. It's really dependent on the mother's health in general. A lot of times baby skin is just so sensitive that any environmental triggers like clothing, detergents, different soaps, other factors in the environment like dust and things like that. So it's really very individualized. It's all dependent on the child and its vital force. And so we kind of try to figure out which trigger is actually triggering that specific child's eczema. And in children, it's kind of the same. If they're not nursing, then they've been introduced to foods now, and usually allergens have been introduced early. So some women, unfortunately, that maybe cannot breastfeed will go to cow's milk formula, and we've seen a big correlation between the protein in the cow's milk and eczema. So they tend to react through the skin. And the kind of great thing about it reacting through the skin is we get to know right away what that child's constitution is like. So it kind of gives you a story behind what that child may be susceptible to. So it's really great information because they react so quickly, and that tells us they can actually heal quite quickly from it too. Yeah.
So what are some of the complications of eczema?
For infants, for instance, I'll give you an example. My son, who was only 3 months old, and we were just actually dealing with this in the last week. And, I'm a naturopath, so perfect naturopathic diet, took all the right supplements, thought I was doing everything right, and all of a sudden his big, cute little cheeks were rubbing up against zippers. And he got a little bit of a rash there, and with their nails, they tend to scratch themselves. And he scratched it, opened it up, and an infection developed from that, and all of a sudden it's all over his cheeks. So I kind of had that mommy moment where my naturopathic hat was off and there was a bit of panic. And I'm like, okay, what did I do wrong? Blaming myself, of course, and going into that like, oh no, what are we going to do about this? And I decided to kind of step back, take a breath, and be like, okay, this could be a staph infection, which is a major complication that can show up. And if that happens, it can be quite serious. So again, I had to look at my child and our diet and all the things that I do and see, okay, is this something that he can just pass, or do I need to go the antibiotic route, which is there for a reason, and sometimes we need to go there. And but I decided to not do that and change my diet, take out all the allergens, anything that was inflammatory, got him some good herbs and a good salve, and 3 days later it's now 95% better. So that is one of the major complications, really, is staph infection, but there is always a way to deal with it, depending on the child. And another complication that can show up, say somebody has a cold sore on their mouth and they kiss the baby or they're around the baby when they're having some sort of eczema, and if there's an open cut, it can actually create herpetic eczema. So it's like a herpes virus that is created. And as the child grows, if there's nothing done to change the triggers in the child, it can go deeper within their body, creating asthma-like symptoms. So a lot of children that I'm seeing now too, that come into the clinic ages 3 to 4 or even older, usually show up with asthma, and they usually have a history of cradle cap and eczema as infants. So that really tells us that there's a huge link between the two. So if you see that your infant has eczema, you really want to get on top of that right away so you know how to deal with it, because that just might be a little sensitive allergic baby that you may have to look at the triggers around them, make sure that they're not there.
Thank
Yeah,
you. So
you're welcome.
this is very, I know I've seen it. I've seen it in our grandson,
Yeah,
um, and we're gonna have to bring him in.
yeah. And it's really easy to treat. They heal so well. And it's just kind of figuring out, like I said, what that specific child needs. And it's just usually education for the parents, because it's so common, we just think, oh, it's just a rash, it'll go away and it's okay. But really, it's something that needs to be looked at deeply. Yeah.
So we've been talking with Dr. Sonya Jensen. She's a naturopath in Vancouver, BC. Her clinic is divineelements.ca, and you can call them at 604-568-3735. Thanks, Dr. Sonya.
Thank you.